Hello, my name is Amol Sharma. I'm an associate professor of medicine at the Medical College of Georgia of Augusta University, and I am very pleased to be able to speak to you today on my talk entitled Leveraging Livestream, Getting the Most from Your GI Telehealth Appointment. And I'd like to thank the IFFGD for inviting me for this 2020 virtual advocacy event. So the objectives of this talk are to understand the what, the when, the why, different types of GI telehealth visits, and what can and can't be done during a telehealth visit, and how to make the most of your telehealth visit with your GI provider. So there are two types of telehealth visits. So what are they? One is a telephone visit where you do not have any video and your provider will call you at a hopefully pre-designated time and you'll review any problems that you have and test results and have a discussion over the phone. And the second is actual video streaming through a telehealth app, either on a phone or smart device, where you can actually see your provider and your provider can also see you to perform a visit. We talked, it's been wanted, and that's even before this coronavirus pandemic. So in 2013, Cisco, a major company, they surveyed almost 1,550 consumers in 10 different countries and found that 3/4 were open to a virtual visit. A year later, MD Live surveyed Americans and found that more than half of them postponed their doctor's visit because of inconvenience. And another survey, about 2,000 adults, found that the top reason for missing an appointment, that's almost 30% of missed appointments, was their inability to take a day off work. So telehealth visits can help address those reasons and problems for missed appointments and increased access. So which reasons for visits are appropriate for the different types of telehealth visits, such as telephone and video visits? For telephone visits, it's most appropriate for established patients with a provider. So these are patients that have been seeing a provider for many months or many years to follow up with. It seems to be appropriate to use the telephone, and this is what I've been doing in my practice. So for particular reasons, such as if you've had a change in your symptoms for non or semi-urgent reasons, so an appointment by telephone to check in with your provider and understand what needs to be done further would work on a telephone visit. Following up in an appointment for chronic disease management with your established provider. So if you have a GI health condition, and commonly in my practice, that may be irritable bowel syndrome, gastroparesis, constipation, things like that, for which you are already established in a practice to have a regular follow-up, especially when things are going okay, it's appropriate to have that by telephone. And then I like to review any positive test results that would necessitate a change in the plan of care with my patients via telephone. I think this is a good use of a telephone visit as well. So telehealth visits the video visits are best for new patients, but sometimes established patients as well. So I like these visits in my practice for pre-common procedural, so GI procedures being upper endoscopy or colonoscopy, to meet the patients ahead of time before these procedures. This could be a good use for telehealth video visits so that patients can be more comfortable with their providers performing these procedures. And then I believe telehealth video visits are great for a first consultation with a specialty GI provider for an ongoing problem. So this is generally when a primary care physician refers patients for the first time to a specialist provider. For second and third opinions, this doesn't seem to be an adequate mode because there's quite a bit of explanation that goes on in these visits that telehealth video visits may not be the best medium for. And in those cases, a more in-depth conversation and physical exam may be required. Therefore, a video visit for the first time with a patient on a second opinion is not always suitable. Now, this is key. Telehealth visits do not replace emergent or urgent care. So, severe new onset abdominal pain with and without fever are the most important GI complaints, which cannot be addressed over the phone or video visits. These are often occult problems like appendicitis and gallstone related issues that should be evaluated most efficiently in the emergency room or ER. Um, there is quite a bit of angst with the COVID-19 pandemic about going to the emergency room. However, it is the safest place to address emergencies in a more timely manner. It would be unfortunate if these preventable causes of mortality, death, or significant morbidity, illness were to go unaddressed because of fear of going to the emergency room. So again, if you have these, especially with GI patients, severe new onset abdominal pain with and without fever, the emergency room is the best place to get care. Urgent in-office visits, when recommended by your doctor, um, you should try and keep these appointments the best you can because oftentimes your doctor is looking at your health condition and sees something that can be intervened on to prevent you from having to go to the emergency room. That's not always possible, especially if you get sick very on a short time frame. But you do want to keep these appointments that are recommended by your doctor. And there shouldn't be significant anxiety or fear because a lot of doctors' offices, like most restaurants and places of businesses, are implementing social distancing measures. Our office is definitely in the waiting room implementing social distancing, encouraging the use of masks, and has always been encouraged to use hand hygiene, which dispensers of hand sanitizer are everywhere in the clinic to facilitate that. So this is my experience with telehealth. As soon as the COVID-19 pandemic arose, our institution at the Medical College of Georgia Augusta University, which serves as a public health institution for the state of Georgia, developed this telehealth app through American Well, one of the providers for telehealth. And we started in the early days of the COVID-19 pandemic, screening patients and prioritized testing for the sicker patients, which followed a very rigorous algorithm that over time, as testing became available for everyone, has now gone away as not needed for a provider to prioritize those patients. But before the pandemic, I did 0 telehealth visits in my practice, and now look forward to transitioning from this experience to telemedicine and telehealth visits to increase access for my patients. Importantly, on March 6th, Center for Medicare Services, CMS, provided a 1135 waiver authority, which was called the Coronavirus Preparedness and Response Supplemental Appropriations Act. And this actually paid physicians for their time on telehealth and telemedicine visits, also creating an opportunity for health care providers to provide their patients other than just in-office visits. So there are some caveats with telehealth, as I and my patients have experienced, transitioning from that very narrow focus of screening COVID-19 patients to then applying it to my practice. And we've had significant issues with connectivity. So there are quite a bit of broadband limitations amongst different areas of the country and of Georgia, and that's no exception. And it takes me back to my days of early internet access through America Online. If you guys remember America Online, it was a dial-up connection, and the connection was often very slow and very spotty. So these telehealth apps can suffer from the same connectivity. If patients are unable to connect to the platform, then there's a limited window of when these appointments are scheduled, and then we're chasing our tail trying to reconnect, and sometimes not able to reconnect, which is unfortunate because of connectivity issues. So to understand this problem and ensure that you have proper connectivity, make sure at the time of your appointment being scheduled, you have tested the app, familiarize yourself with the app, with the scheduler to make sure that you have a robust connection so that you do not unfortunately miss your appointment for this reason. Insurance coverage is improving, but yet right now the insurance rules and regulations are not completely known. So check with your insurance provider to make sure that your provider, your healthcare provider, your GI physician is in network before you schedule your visit to make sure it's covered. And then there are regulatory issues. As an instance, and you can see in the bottom figure, I live in Augusta, Georgia, and practice at Augusta University. And North Augusta, even as a namesake, falls in South Carolina. So as current, I cannot see my North Augusta residents, even though they're closer to me than most people living in Georgia, by telemedicine. And this is just one example, and many practices live on state borders, so they have to be aware of this, that they may be able to see those patients in clinic, but not via telehealth or telemedicine. So hopefully this will be changed. And as time goes on, people will get licenses in multiple states to accommodate this. But just be aware that you may not be able to be seen by your routine provider if you live in a different state. So the pros of telehealth for patients, this dramatically increases access to care for patients. And telehealth is cost efficient. To implement this, it doesn't cost health systems significant amount of money compared to other expenditures. And you engage patients more easily to get better patient outcomes. You're able to see them more frequently, hopefully increase access, and more mediums other than an office visit. And if you're a patient, then you're very well familiar with waiting in the waiting room. And it can be quite frustrating, as this cartoon illustrates. So long wait times can be avoided in the waiting room, especially, and you can kind of wait for your appointment in your home or work, wherever you may be, instead of having to bring yourself into a waiting room. And then the pros of telehealth for providers is that you don't need transportation for your patients. They don't need to miss work, which is also good for happy patients and that dreaded waiting room that we talked about. The cons for telehealth are similar for both patients and providers. We talked a little bit about the regulatory and industry barriers to telehealth, being the platform, connectivity, and the regulatory issues across state lines and otherwise with insurance coverage. A physical exam is very limited on a telehealth visit. The doctor can only document the physical exam that they can actually see, which this antiquated stethoscope some doctors have commented they haven't used their stethoscope for 2 to 3 months, and that's the case during this pandemic, and it doesn't allow for a very robust physical exam. So in my practice, where I feel like a physical exam is necessary, I will have the patient come in to clinic a week to 10 days later and do a thorough physical exam if I feel like it's going to help change their care. Telemedicine equipment and technology Not everybody has the latest iPhone or Android device or computer or broadband access. So unfortunately, those patients may not reap the benefits of telemedicine and telehealth. And electronic medical records, the integration of the app is not as robust. Currently, we use one platform, American Well, for telehealth, which doesn't go into our electronic medical record with Cerner. So those two are separate. So I've had some patients that message me through the telemedicine app that does not go into electronic medicine app. So sometimes those messages don't get addressed in as timely of a fashion. So as time goes on, these telemedicine apps will hopefully be integrated into the electronic medical record so that all the messages and telephone calls go into the same record. So be aware of that. You may want to message on both your patient portal and your telemedicine app. And then also between hospital, the electronic medical records do not connect well. So if you're going to see your doctor for the first time and your previous doctor has sent records, I think it's important to realize in my practice that I'll get a record of 100 pages, and maybe 5 of those pages will be very important to me in the care of that patient. So either I print substantial and waste substantial amount of paper printing records to find those 5 pages, or I'm sitting there scrolling, which can take quite a bit of time to find the important pages. So don't get frustrated with your providers if they ask you to recant the history. They'll ask you the pertinent information, but do realize that it's an inefficient process for providers to go through the records. Now that is being improved. We are working with our local hospitals to categorize records, to put labs in one place, radiology in one place so that it's more searchable. So that's hopefully a better working process, but do recognize that the records, when doctors get it, it's not an efficient way to review the records. So what about preparing specifically for a GI telehealth visit? Organize your thoughts. So this is very important. Don't try not to just show up to your visit. Doctors' times are very limited. They have to run from appointment to appointment. So prioritize your problems. Sit there and think, what are my 2 to 3 top issues? And list them out so that you don't forget them. And also discuss if you have some concerning results that you're worried about, make sure you write them down so you can talk to your doctor about them to discern what's very important or critical from maybe what's noise. So the bothersome issues that you do list, it's important to note how long they've been going on for. Is this a very new problem, or has this been going on for many months or years? And how is it really impacting your day-to-day life? Is it really hindering you from being able to do things that you enjoy or doing necessary chores around the house? And especially at work, is it limiting how you're able to be productive at work? So those are things to note with your problems. And then I always appreciate when my patients bring a summary of their problems. Now, try not to go in significant detail in the summary, but one-page summary can be helpful for your provider that you've typed out, noting surgeries that you may have had, endoscopies or colonoscopies that you may have had, significant changes in your medicines that have occurred that you think correlate to your symptoms. These things are very, very important to summarize for your doctor. So if you could have that ready ahead of time, it also allows you to think through what has been going on when it's occurred. Also, we call these red flag symptoms. So in GI, if you've had weight loss when you haven't tried to lose weight, that's important. So note that, how long it's been going on for, how much you've lost, and then blood in the stool or black tarry bowel movements can indicate blood being digested through the tract. So those things are also very important to note for your provider. Now, as technology gets better, we're better able to obtain those symptoms from you in an organized manner. But, as providers, we're also trying to organize the symptoms in a way we collect it. So instead of putting the burden on you to keep a diary of your symptoms, our lab is also creating apps on phones and smart devices to then garner this data. For instance, we have a constipation app that allows people to keep their bowel diaries that we're developing so that it organizes things in an easy to review manner for both patients and providers. So this is one way you can look for apps that are existing on devices for the different symptoms that you have, and you may be able to more organize your symptoms in a better way, and then display it to your provider so that they can understand, how often and how long and how severe your symptoms are, and find a plan for treating it. So preparing for your GI telehealth visit, like we discussed at the time of scheduling your appointment, make sure that you have good connectivity. Make sure that you familiarize yourself with the online app and platform so that you're not fumbling around during the visit trying to make things work and adding stress to already a time limited appointment. So that's very important. Have things organized. And then uh, understand if your online platform is linked to your electronic medical record, like we discussed, so you don't expect to hear from the doctor when the doctor never received your message because your online telehealth app doesn't connect with your EMR. And then try and organize. The more time you spend doing homework for your visit, the more productive your visit will be because your doctor will also be able to follow what's going on. So at the conclusion of visit, what should you ask your doctor? So things that I like when my patients ask is, I listen to my patients, and then I like for them to give me time to explain things, and then I love it when patients are actively listening. So the questions that they're asking are related to what we're discussing. So, if we're ordering a test, for example, I love it when patients ask me, what should I expect to find with this test? Or what are you looking for, doc? So I can explain to them exactly what test we're ordering for what reason. Um, and then if we decide a treatment or a way to treat any problems, how long should I expect for this treatment to really kick in and work for me? When should I know that it's not working for me? And when should I contact you to consider something else? And maybe what should that other thing be? Just different directions that we need to go in. And then what symptoms should concern me? What should make me go to the emergency room? Or what should prompt me to call into the office and request an earlier visit? Things like that. So, the expectations are in line between the provider and the patient that allows a successful management of maybe even very complex and difficult problems. So, in summary, telehealth is right now in its early innings, and for better, I think the COVID-19 pandemic has moved this needle forward in this that would otherwise take a lot longer. And it will improve with time. The more we get experience, the more our patients get experience with telehealth. Hopefully, it increases access to your provider and allows better care all the way around. So have realistic expectations of the care you can receive via telehealth. So understand that emergencies are not going to be addressed by telehealth. You should present to the emergency room. That's the safest way and the most expedient way to get taken care of for emergencies. And then what could be urgent, what could be semi-urgent, when to request appointments. Um, and then do your homework before your telemedicine visit or telehealth visit to get the most understanding, the most out of your telehealth visit so that we can successfully resolve your problems between you and your provider. So again, I'd like to thank the IFFGD for organizing this event. I hope it's helpful to many patients out there, and definitely partner with your provider, whether it be through telehealth or in the clinic. to help move the needle forward in terms of your care as well as other patients' care. Thank you.